I would like to ask you both permission to use this video for educational purpose and on internet.
Yes.
Now, do you have any problem whatsoever that I use your story to educate my other patient at all?
No, I don't have any problems with that.
Why don't you have any problem with that?
Because if I would have known what I know now 6 years ago, I would be back in a normal life.
6 years ago, you would have been, are you back to more or less normal life now?
Very close to it.
Very close to it. Now, your surgery was 3 months ago. We did actually a 2-level fusion, and actually I'm going to turn around. Bone already is growing very rapidly here, and we are very close where we need to be. And surgery was 3 months ago. How bad was the back pain and leg pain before the surgery?
Almost as bad as childbirth. It
Yeah.
was debilitating.
For how long?
I dealt with it for 6 years of
Okay.
being on narcotics and doing the physical therapy and everything, which just nothing helped.
What did they tell you in that 6 years?
In that 6 years that I needed to have bypass surgery, gastric bypass, to lose the weight before they could do a fusion on me.
Your surgery with us was not a problem at all. It was about less than an hour surgery. How long did you stay in the hospital?
A day and a half, I believe.
Yeah, just one night?
Yep.
Yeah. And now, how bad is the leg pain?
Almost non-existent.
And the back pain?
Very slight.
Very slight. And the bone is growing. So for 6 years, you have been told they cannot help you. And but we did a less than an hour surgery. And now you're on the path. About 3 months later, you're on the path to live a normal life. Now, you couldn't lose weight for so long.
Correct.
What happened after the surgery?
I've lost 22 pounds.
Because you can walk finally.
Yes.
Okay. Now, this is a very common story, and you still have some symptoms with certain activity you just told me, which is completely normal. And so you're pretty much average what we expect after our surgery 3-4 months later. It's still going to get better. Okay, and I really thank you for giving me the opportunity to use your story for patients in similar situation, because without your story, other patients would have no way of finding out about what we are doing to help people in your situation. And for many of our colleagues, your situation is prohibitive for a surgery because that surgery is just too risky. So they are good surgeons, but their kind of surgery is just too damaging, especially if you have a higher BMI. Now, for that reason, I think your story is very helpful to help other people in your situation, that there is a hope and they don't have to live in pain. So for that, I thank you. Okay?
No,
Thank you.
Thank you.
It's been a blessing.
Yeah.
It
I mean, the
has.
progress through this compared to the long wait she had before and the other hurdles when they were talking about conventional surgery.
Yeah.
This has been a blessing, and it's moved along quite well.
Yeah.
So-
Yeah. Now, I see that very often, that people who come to me, they have been in other places and have been denied surgery, and they have been told they have to live with the pain. You have been observing probably closer than anybody else. How was for her living with the pain? How was it?
It was tough to watch her in that kind of pain, and then to go to the other back doctor every 6 months and find out that he wouldn't do the surgery because of her weight, or they wanted her to have gastric bypass before they do it. And then to come to you and find out that's not an issue,
Yeah.
and to have it done, like I said, it's a blessing.
Yeah.
It's
And
been pretty
I'm
awesome.
hoping that, your story as well help other patients in similar situation to know
There's options.
there's an option.
Yep.
Okay. Do you have any problem, even if I, let another patient call you or put your information publicly online for other people to know there is a hope? Do you have any hesitation there?
No hesitation there.
Why don't you have any hesitation for
Because-
your name, for your information to be out there for other patients to?
If it helps somebody else get to the point in their life where they can regain it back, I'd be happy to help.
And she knows what she's gone through before we found
Yeah, and those
out
patients are
about
going.
this.
Yeah,
So
those
they're
patients are going
the
through this.
same.
Yeah.
Same. Well, thank you so much. I really appreciate that.